Welcome to our class today, HS 3210, Term 5, Written Assignment Unit 2. Today I will talk about single cell disease and iron deficiency comparison, comprehending causes, symptoms, diagnosis, and treatment. Introduction, key points. The blood carries nutrients and oxygen throughout the entire body. Anemia gets formed when the body fails to supply sufficient hemoglobin or red blood cells. This presentation will compare iron deficiency anemia, IDA, and sickle cell disease, SCD. Objectives: proper understanding of the causes, symptoms, diagnosis, treatment, and the key differences between the two disorders are very important. Iron deficiency anemia is a critical disorder, and there are risk factors linked to this disorder, such as pregnancy, poor iron and dietary intake, gastrointestinal bleeding, health menstrual bleeding, and chronic illnesses. The common symptoms like weaknesses, fatigue, dizziness, shortness of breath, pale skin, and brittle nails. This is an illustration of how this disease can be described. How low iron leads to fatigue and weaknesses. Low iron, you encounter reduced hemoglobin and decreased oxygen transport, fatigue, and weaknesses. Sickle cell disease. The risk factors associated to this disease are family history, high prevalence of with the population from the African history, inherited mutation in hemoglobin genes. Common symptoms: you encounter swollen hands and feet, frequent infection, children delayed growth, anemia, fatigue, and several crises. This is an illustration of this disorder. We have a normal red blood cells versus single cell shaped red blood cells. You can see in the right left side, you have the normal red blood cells. This is the shape of a normal red blood cells. But when you look at the other side, you can see the shape has changed. So this is how single cell occurs or appears. Causes and pathophysiology. Iron deficiency anemia caused by insufficient supply of iron, low hemoglobin production in bone marrow, little oxygen reaches to the body tissues. The red blood cell tends to be pale and small. Single cell disease. This is caused by genetic mutation that produces abnormal hemoglobin. Red blood cells tend to be rigid and crescent-shaped. Blood vessels are blocked by cells, making them break apart easily. Painful crisis and chronic anemia develops. Symptoms connections. Both disorders have low oxygen delivery, leading to fatigue. In SCD, vessel blockage further leads to organic failure and severe pain. This is a description of how this occurs. Iron deficiency, which is known as anemia. On the right side, you have a single cell disease, SCD. And you can see the causes, effects of bone marrow, effect on red blood cells, results. Less hemoglobin means no or few oxygen carried into the body tissues. Outcome, somebody feels fatigue, weaknesses, and short of breath. On the other side, the single cell you can see is genetic, and it has effect on the blood cells, and it also has got effect on the blood vessels, and the results are blocked blood flow and destroyed red blood cells, reducing oxygen delivery to the damaged organs. And outcome will be chronic anemia, recurrent painful crisis, and long-term organ failure. Let's talk about diagnosis and the treatment. Iron deficiency anemia and single cells. Uh, you can diagnose this differently or sometimes similarly. Complete the anemia requires complete blood count, similar to single cells, also requires a complete blood count. Serum repeating tests, single cell it requires hemoglobin electrophoresis. Ion studies, while these are the one single cells is genetic testing, tool testing for the anemia deficient, iron deficient anemia for the bleeding, while on the single cell we test newborn screening. Treatments. IDA requires iron supplements, dietary improvements, treating underlying bleeding causes, while SCD requires intraosseous therapy, blood transfusion, blood management, bone marrow transplant in selected areas. This is the diagram of treatment, and we have comparison and analysis, similarities and differences. Both causes fatigue. Uh, the difference is IDA is acquired or nutritional, while CD is genetic. While on similarities, we all have a reduced oxygen delivery. Both require blood tests, and both might need long-term management. While on the differences on the other side is IDA affect reproduction of hemoglobin, while SCD alters the structure of hemoglobin. SCD causes pain, occlusive crisis, and SCD may cause multiple organ damage. Real-world example, we can assume or just consider red blood cells as a cargo vehicle in scenario of iron deficiency anemia. The vehicle is equipment are not complete to carry oxygen. That means it's moving, but doesn't have all the requirements. In the case of single cell disorder, the vehicle gets broken and is stuck on the road, preventing oxygen from reaching the entire body, similar to a vehicle which is totally broken and causing traffic. This is a comparison of or illustration of the single cell and the iron deficiency anemia. In conclusion, takeaway is the two disorders causes fatigue and anemia. The iron deficiency anemia is caused by insufficient iron for synthesis of hemoglobin. Single cell disorder occurs due to inherited abnormal hemoglobin. Getting diagnosed at early stages and getting the right treatment is crucial for quality of life improvement. Awareness in the community helps in screening, prevention, and timely health care. Thank you very much for your time.